When your employment ends and you aren't enrolled in Part B, certain things can happen. You may get a chance to elect Consolidated Omnibus Budget Reconciliation Act or COBRA coverage, which continues your health coverage through the employer's plan, in most cases for only 18 months and probably at a higher cost to you. Or you may get a special enrollment period to sign up for Part B without a penalty. This period will run for 8 months and begin the month after your employment ends. This period will run whether or not you elect COBRA. If you elect COBRA, don't wait until your COBRA ends to enroll in Part B. If you enroll in Part B after the 8-month special enrollment period, you may have to pay a late enrollment penalty, and you'll have to wait until the next general enrollment period to enroll. Medicare doesn't pay all healthcare costs. One way to pay to cover the cost or gaps is to purchase a Medicare supplement insurance or Medigap policy. We'll discuss these policies in more detail later, but it's important to know that when you sign up for Part B, you have a 6-month Medigap open enrollment period, which gives you a guaranteed right to buy a Medigap policy. Once this period starts, it can be delayed or repeated. Let's move on. Medicare Part A hospital insurance helps cover medically necessary inpatient services, hospital inpatient care, semi-private room, meals, general nursing, other hospital services and supplies, as well as care in inpatient rehabilitation facilities and inpatient mental health care in psychiatric hospital lifetime, limited to 190 days. Inpatient skilled nursing facility care, not custodial or long-term care under certain conditions. Blood, in most cases, if you need blood as an inpatient, you won't have to pay or replace it. Certain inpatient healthcare services in approved religious non-medical healthcare institutions. Medicare will only cover the inpatient non-religious, non-medical items and services. Examples include room and board or any items or services that don't require a doctor's order or prescription, like unmedicated wound dressings or use of a simple walker. Home health care, a doctor or certain healthcare provider who work with the doctor must see you face-to-face to certify that you need home health services. You must be homebound, which means that leaving home is a major effort. Next, hospice care. Your doctor must certify that you are expected to leave 6 months or less. Coverage includes drug for pain relief and symptom management, medical, nursing, and social services, as well as services Medicare usually doesn't cover, such as grief counseling. I just want to make a note, Medicare doesn't pay for your hospital or medical bills if you're not lawfully present in the United States. Also, in most situations, Medicare doesn't pay for your hospital or medical bills if you are incarcerated. Next one is you usually don't pay a monthly premium for Part A coverage if you or your spouse paid Medicare taxes while working. This is sometimes called premium-free Part A. Federal Insurance Contribution Act or FICA tax is a United States federal payroll or employment tax imposed on both employees and employers to fund Social Security and Medicare. About 99% of people with Medicare don't pay for Part A premium since they've have at least 40 quarters of Medicare covered employment. Enrollees 65 and over and certain persons with disabilities who have fewer than 40 quarters of coverage pay a monthly premium to receive coverage under Part A. If you aren't eligible for premium-free Part A, you may be able to buy Part A if you are 65 or older and you have or are enrolling in Part B and meet the citizenship and residency requirements. Under age 65, have a disability and your premium-free Part A coverage ended because you returned to work. If you are under 65 and have a disability, you may continue to get premium-free Part A for up to 8.5 years after you return to work. In most cases, if you choose to buy Part A, you must also have Part B and pay a monthly premium for both. The amount of the premium depends on how long you or your spouse worked in Medicare-covered employment. Social Security determines if you have to pay a monthly premium for Part A. In 2017, the Part A premium for a person who has worked less than 30 quarters for Medicare-covered employment is $413 per month. Those who have between 30 and 39 quarters of coverage may buy Part A at a reduced monthly premium rate, which is $227 for year 2017. If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10% for every 12 months you didn't have the coverage. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. If you have limited income and resources, your state may help you pay for Part A and or Part B. You can call Social Security number for more information. Medicare covers semi-private rooms, meals, general nursing, and drugs as part of your inpatient treatment and other hospital services and supplies. This includes care you get in acute care hospital, critical access hospitals, inpatient rehabilitation facilities, long-term care hospitals, inpatient care as part of a qualifying clinical research study, and mental health care. This doesn't include private duty nursing, a television or phone in your room, if there is a separate charge for these items, of course, or personal care items like razors or sleeper socks. It also doesn't include a private room unless medically necessary. If you have Part B, it covers the doctor services you get while you are in a hospital. Medicare covers certain inpatient healthcare services in approved religious non-medical healthcare institutions. Medicare will only cover the inpatient, non-religious, non-medical items and services as we discussed earlier. Staying overnight in a hospital doesn't always mean you are an inpatient. You only become an inpatient when a hospital formally admits you as an inpatient after a doctor orders it. You're still an outpatient if you're not being formally admitted as an inpatient, even if you're getting emergency department services, observation services, outpatient surgery, lab tests, or x-rays. You or a family member should always ask if you are an inpatient or an outpatient each day during your stay, since it affects what you pay and whether you'll qualify for Part A coverage in a skilled nursing facility. Let's move on to the benefit periods. A benefit period refers to the way that original Medicare measures your use of hospital and skilled nursing facility services. A benefit period begins the day you are admitted as an inpatient in a hospital or a skilled nursing facility. The benefit period ends when you haven't received any inpatient hospital care or skilled nursing facility care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the Part A inpatient hospital deductible for each benefit period. There is no limit to number of benefit periods you can have. Let's look at this through an example. Let's say you spend 5 days in a hospital. You then enter a skilled nursing facility for 20 days of rehabilitation. You then return home. Your benefit period will end when you've been out of the skilled nursing facility for 60 days or 85 days after you first entered the hospital. If you don't return to the hospital as an inpatient in that time frame, you'll pay another deductible for the next benefit period. You've returned home after being an inpatient in the hospital or in a combination of hospital and a skilled nursing facility, for example. After 2 weeks at home, you must return to the hospital. You haven't been out of the inpatient care for 60 days, so you're still in your first benefit period. You don't have to pay another hospital deductible. To qualify for post-hospital extended care services, you must have been an inpatient of a hospital for a medically necessary stay of at least 3 consecutive calendar days. The 3 consecutive calendar day stay requirement can be met by staying totaling 3 consecutive days in one or more hospitals. In determining whether the requirement has been met, the day of admission but not the day of discharge is counted as hospital inpatient day. It is important to note that an overnight stay doesn't guarantee that you are an inpatient. An inpatient hospital stay begins the day you're formally admitted with a doctor's order. So I hope that we're clear on that. Paying for inpatient hospital stay. For each benefit period in 2017, you pay $1,316 deductible and no copayment for days for the first 60 days of each benefit period. $329 per day for days 61 through the 90 each benefit period. $658 per lifetime reserve day after day 90 each benefit period up to 60 days over your lifetime. In original Medicare, these are additional days that Medicare will pay for when you are in the hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for daily coinsurance. All costs for each day after the lifetime reserve days. I just want to make a note here as well. Inpatient mental health care in a psychiatric hospital is limited to 190 days in a lifetime. If you qualify, Medicare will cover the following skilled nursing facility services. Semi-private room, a room you share with one other person. Meals, skilled nursing care, physical, occupational, and speech-language therapy if needed to meet your health goal. Medical social services, medications, and medical supplies equipment used in the facility. Ambulance transportation to the nearest supplier of needed services that aren't available at the skilled nursing facility when other transportation endangers health. And then dietary counseling. Let's move on. Part A will pay for skilled nursing facility care if you meet the following conditions. Your doctor must certify that your condition requires daily skilled nursing or skilled rehabilitation services, which can only be provided in a skilled nursing facility. This doesn't include custodial or long-term care. Medicare doesn't cover custodial care if it's the only kind of care you need. Custodial care is care that helps you with usual daily activities like getting in and out of bed, eating, bathing, dressing, and using the bathroom. It may also include care that most people do themselves, like using eye drops, oxygen, and taking care of a colostomy or bladder catheters. Custodial care is often given in a nursing facility. Generally, skilled care is available only for a short time after a hospitalization. Custodial care may be needed for a much longer period of time. You were in an inpatient in a hospital for 3 consecutive days or longer before you were admitted to a participating skilled nursing facility. The 3 consecutive calendar day stay requirement can be met by staying totally 3 consecutive days in one or more hospital, as we discussed earlier. You were admitted to the skilled nursing facility within 30 days after leaving the hospital. And then next, your care in the skilled nursing facility is for a condition that was treated in the hospital or arose while receiving care in the skilled nursing facility for a hospital-treated condition. And then the last one, the facility must be Medicare participating skilled nursing facility. All right, so next one, skilled nursing facility care is covered in full for the first 20 days when you meet the requirements